Alrighty. So today we are going to chat about public health 4000 core competencies in public health, which is a very extremely important topic in public health. So I think what is important, like the question is, what are the core competencies? What are they? Why are they created, and what does this mean to me? First of all, I would like to thank Shah Hujikamer, who is our sessional instructor for Public Health 4000, who have provided 2 days lecture slides. I had the lecture slides as well, but her lecture slides are uh, had more information, so I'm just using hers with her consent. So just like to acknowledge her contribution here. Uh, but let's keep moving forward. Like I think it's important. I think, and I'll not bore you to death with lot and lots of information, but I'll give you a little bit brief history of what happened. And again, I included some of the links here. You can copy and paste in the Google, find the whole document and read it through if you really want to understand the history. And you should know the history very well as well. So uh, so what happened was that I think we had a SARS outbreak in the world in 2000 I think in around 2003. So that sort of the emergency at that time. I think the identifying a need to strengthen the public health was spurred by that. We started to realize that we need a good public health infrastructure to fight against these health emergencies. Um, and again, this is the best time we live in. This is the worst time we live in, but I think from I'm saying that the best time is best time from teaching point of view. Best time uh, from I think what I'm trying to say here is that COVID-19 pandemic, for instance, has highlighted the importance of public health in a country. These days, because of the international trade and travel, an epidemic can easily become pandemic so fast. And if we don't have a strong public health system to fight against it, we can succumb. Whole countries can, again, as you can think, imagine how grave this pandemic has been, how serious this pandemic has been. So many people, unfortunately, have lost their lives. So sad, right? The one tiny virus has brought the whole world on its knees, and to fight against this. And again, we will overcome this pandemic. We have already started vaccination. We are very hopeful, right? And we will overcome this eventually. But the important thing is that to minimize the impact, to minimize the loss, we need a great public health system, right? And today it's COVID-19 pandemic. Uh, More than like 15, 17 years ago, it was a SARS outbreak. It was nowhere near COVID-19 pandemic how grave this has been. But the SARS pandemic, the SARS outbreak was, I think, as of August 2003, there had 438 probable and suspect SARS cases in Canada, including 44 deaths that were there. I think it's also obviously the toll on the healthcare workers was high, which is the case in COVID-19 as well. Like there's so many healthcare professionals who work or essential workers as well who continue to work in this pandemic and sometimes unfortunately pay the price for it as well, uh, while serving the community, doing the great. So again, in that time as well, there were more than 100 became ill and 3 succumbed to death in that SARS outbreak as of August, well, like until the August 2003. Now think about it. Those numbers currently, when we read it today, they look like nothing when you compare the numbers that we are having with COVID-19. But at that time as well, that still number, as you can see, for instance, is 438 cases, not small number. Okay, any life that we lost, it's not a small. It's not a small. So all this SARS outbreak created a need of public health. And I think what we learned very rapidly that Canada's ability to fight an outbreak such as SARS was tied more closely to specific strengths of our public health system than the general capacity of our publicly funded personal health services system. Okay. So by public health, we refer to systems They are population-based and include functions such as population health assessment, health and disease surveillance, disease and injury prevention. That includes the outbreak or epidemic containment, health protection, and health promotion. So our analysis, I'm reading the quotes from National Advisory Committee on SARS and Public Health Canada. So they say that our analysis and our recommendations accordingly set out a plan for comprehensive renewal of both public health system in general and the nation's capacity to detect, prevent, understand, and manage outbreaks of significant infectious disease. It's interesting that we read this sentence today. Imagine if we didn't have these, how slow we would have been in our response to COVID-19 pandemic. And if we were that slow, imagine how many people we would have lost today because of COVID-19. Okay, it's very interesting. It's fascinating how this pandemic has evolved, and it's yeah, and so that's a whole again. It's as you can see, like I have a lot of passion on this topic, and I teach in infectious disease, and we'll talk a lot at great length about this. But again, it's important. It's what I think overall that we need to understand is that no matter how great a country's healthcare system is when you treat patients on one-on-one. Let's just say how many great physicians you may have in a country, how many great infrastructure you may have in a country. But if the overall public health infrastructure is not that great, if the public health response, emergency response and disaster management, if that is not planned very well, we could still lose a lot of lives. So that is the reason why it's important of creating something to strengthen the public health infrastructure in a country. So in response to that, in 2005, the Joint Task Groups on Public Health Human Resources released a document which called Building the Public Health Workforce for 21st Century, a pan-Canadian framework for public health human resources planning. So the rising rates of the chronic disease that we have seen over the past few decades and consistent major health emergencies as well, SARS, influenza, opioid crisis, COVID-19 pandemic, and who knows what next. Service delivery problems in rural and remote locations and in the First Nations in Inuit communities as well. So this document highlights the visions that through collaborative planning, all jurisdictions in Canada will have a flexible, knowledgeable public health workforce working in safe, supportive environments to meet the population's public health needs and reduce health and social disparities. Thank God we had thought that through in 2005. But there were some challenges that are identified in this document, and I'll not go in depth because again, I don't want to bore you to death with too many details. Again, with online delivery, I think I expect the students to go and read that on their own as well. So make sure you read this document and identify some of the challenges as well. But it's required, like the Joint Task Force recommended the collaborative approach, public health human resources planning, and that suggests this approach would enhance the public health sector's ability to day-to-day functioning, the business, allow jurisdictions to share specialized human resources such as expertise in environmental toxicology, and to when one jurisdiction requires surge capacity. That's what we have been doing in public health COVID-19 pandemic as well. Health education programs to prepare students like UFL. Our program is founded on the core competencies in public health. This is the only undergraduate program in Alberta that we offer in. Improve the quality and how do we develop or structure the programs? Looking at the core competencies. Think about it. The core competencies is a template, skills, competencies that are required to be a public health professionals in Canada. So we develop the coursework around those core competencies, making sure that the graduates from those programs have basic competencies to be able to practice in the field. That makes sense. Improve quality and standard of public health, looking at the self-reflection, engaging in the professional activities, having a mindfulness of like the areas of strength, areas of weakness, it can improve the quality and standard of public health overall as well. Could reduce the duplication and make more effective use of financial resources to develop planning data and tools such as the forecasting models and so on. And of course, encourage innovation in development and deployment of the workforce. So that's the building blocks. The Joint Task Force proposed a building block approach to strengthening public health workforce. For the framework to be effective, the public health sector must have each block in place. Uh, but the diagram, keep in mind, the diagram is not intended to show any hierarchy of priority. Work should proceed on all building blocks concurrently. However, the blocks at the base provide the foundation for the framework. So spend some time reviewing this building block. But overall, like this is just a brief, very brief history. How were the core competencies developed? So 2005, Joint Task Group on Public Health Human Resources drafted the first version, you can say the draft one of the core competencies or the draft one of the document. And after the preliminary consultation, so they did after that, having the draft one, they consulted public health stakeholders across the country, and they developed based on the feedback that they received, they developed the draft two in 2006. So that's what they did, Public Health Agency of Canada, in consultation with the stakeholders. That included a glossary of terms relevant to the core competencies of for public health. So that's the second draft. Second draft was shared and discussed with a large number of public practitioners and with the representative of all levels of government, and that resulted in a document called Core Competencies in Public Health in Canada. And I included the citations in your template as well. So that's a core competencies document that we refer to, and we use that in our program. So what are the core competencies? Core competencies, they strengthen the public health capacity by strengthening and developing the public health workforce, right? They are essential skills, knowledge, and attitudes for public health practice. They are the building blocks for effective public health practice and the use of an overall public health approach. The generic core competencies provide a baseline for what is required to fulfill public health system core functions. These include the health assessment, population health assessment, surveillance, disease and injury prevention, health promotion, health protection, and so on. So it's very crucial. The having the competencies is very crucial because remember, public health practice is a highly interprofessional, and many public health providers they have overlapping competencies. The framework advocates a skill or competencies based rather than the discipline or profession based approach to public health health resources planning. So it's really important. Like, why do we need them? Like, why do we need the core competencies in public health? The reason is we need them to improve the health of public via effectiveness of the workforce. If the workforce is effective, if the workforce is qualified, it improves the health of public. Service delivery that is evidence-based. Again, it's not something because I dreamed this, I want to have this approach or initiative or this program. No, we believe evidence-informed public health. That is a big part. Remember this term. We practice evidence-based public health, just like we practice evidence-based medicine, right? It's not because, I see a patient, the patient has diabetes. Today I feel like giving you Tylenol. Tomorrow I may feel like giving you a Tylenol 3. The month after, if you come for the same reason, I feel like, oh no, I just want to start you an antiviral for the same disease. No, it doesn't work that way. Okay, we practice evidence-based medicine the same way we practice evidence-based public health. Okay, and it's also unified workforce that has a shared understanding of key concepts and practices. That's the reason why we need them. Better able to explain the nature of public health and public health goals. That's the reason why we need them. And also it benefits those who work in public health as well. Like for instance, the guidelines include the basic knowledge, skills, and attitudes that are required for public health. So there will be the consistency in the job description and performance assessment. So like for instance, it's easy if there is a template, if there are guidelines, and we can see or easily, we can easily, it makes it easy to have a template for performance assessment, guiding against those competencies, right? It helps with recruitment. recruitment, we can highlight that we are looking for these competencies. Easy. So it creates a consistency in that. Rationale for developing curriculum and training. I give you an example of our program, right? It it gave us a rationale that no, we need public health. Not only, yes, that there were so many programs across the country who provide the graduate training in public health, but there are very few and none in Alberta that provides the education in public health so needed at the undergraduate level. Rationale for developing the program, rationale for developing curricula. We there are these are the competencies that in public health we need to develop a program such a way that the graduates of the program has those competencies. And you know what? I think the students, and that's the reason why I think we introduced the public health core competencies in public health 1000. Uh, I think so. You and I hope you recall that. The reason why and the reason why I included this assignment in this course is that I want you to self-reflect on those core competencies and to be able to find the areas of strength in those core competencies and areas of improvement as well. Because again, being mindful of our strengths and areas of improvement makes us better public health professional, which is so important right now. Okay, it improves the consistency of the graduates or the workforce skill sets, and then and the support discipline specific competencies as well. So how do they help organizations? Obviously, they help organizations identify the required skills. Like if they say, this is currently this position requires the competencies of professionals with the competencies in these days. Identify helpful numbers and the mix of public health professionals with a variety of the competencies as well. With identify the recruitment, training, development needs, rationale for securing funding for workforce development, and facilitate collaboration, shared goals, and interdisciplinary work as well. So who are they for? So again, the core competencies are frontline provide everyone who works in public health or about to work in public health. Like it's good for core competencies are for their frontline providers, consultants, agencies, managers, supervisors, those with the post-secondary education in public health, discipline-specific sets of competencies, assessing, creating base mix of competencies for specific team organizations. Everyone involved who work in public health, about to work in public health, related to work in public health, it's for all of them. So who is responsible? It's a shared responsibility between individuals, employers, professional organizations, educational institutions, regulatory bodies, unions, government, and the government, when I say it's federal, provincial, territorial, and the local government, that it's a shared responsibility ensuring that the public health practitioners acquire and maintain competence and professional proficiency in all of the category, and that is a shared responsibility across all of them. Okay. Attitude and values. All public health professionals share a core set of attitudes and values. These attitude and values have not been listed as a specific core competencies for public health because they are difficult to teach and even harder to assess. But however, they form the context within which the competencies are practiced, which is crucial. This makes them equally important. These values are rooted in the understanding of the broad determinants of health and the historical principles, values, and strategies of public health and health promotion. So again, you don't see them in the specific competencies, but they are embedded in all of the core competencies, like commitment to equity, justice, and sustained development. Absolutely crucial. Importance of health and health of individual and community. Respect for diversity, self-determination, empowerment, and community participation. And finally, these are the core competencies set by Public Health Agency of Canada. Okay, I said the Public Health Agency of Canada was born because of the SARS outbreak, which laid out these competencies. How many? 7 competencies: public health sciences, assessment analysis, policy and program planning, implementation, evaluation, partnerships, collaborations, and advocacy, diversity and inclusiveness, communication, and leadership. This is not an exhaustive list. Public Health Agency of Canada, I know that they're working on to update these competencies, but until we receive the updated versions of the core competencies, we are going to use this as a template for the purpose of this course as well as the program. So I'll not go into much depth. Again, what I want you to review is that I'll post the core competencies document. Make sure you go through that, because within that competencies, there are sub-competencies listed. And make sure you read those sub-competencies. And again, that's your assignment. So I'll not go into the same details. Once you read that, it's very clear. You don't need anyone to explain those. It's so self-explanatory. Okay. So, but I think what I want you to know is that competencies overlap, and so does the examples of the activities that you may have engaged or gained those competencies in. Okay. So make sure you spend some time on that. Uh, the first competency, public health sciences, which is defined as a key knowledge and critical thinking uh, skills related to public health sciences and the ability to apply that knowledge in practice, which includes a few fields. And again, it's not an exhaustive list: behavior and social sciences, biostatistics, EPI, demography, workplace health, prevention, chronic disease, infectious disease, psychological problems and injuries, environmental health, and so on. Right. So that's your first competency. Second competencies is describes the core competencies needed to collect, assess, analyze, and apply information, which includes the data, facts, concepts, and theories. Right? These competencies are required to make evidence-based decisions, which is crucial for evidence-based decision making, which is crucial for evidence-informed public health. Uh, to prepare budgets, reports, investigations, and make recommendations for policy and program development. And policy and program development, this is the next competencies, which effectively chooses options and plan and implement and evaluate the policies and the programs. The next competency is partnerships, collaboration, and advocacy. As I said, partnerships and collaborations. It's so crucial. Again, to be able to work in teams, so crucial. So this category captures the competencies required to influence and work with others to improve the health and well-being of the public through the pursuit of a common goal. And you can practice these competencies by working in a group work in this course. This one and the communication one, for instance, is, and so and there's many other ones as well. Uh, so it's again, spend some time going through these core competencies. Diversity and inclusiveness is the next one, which identifies the socio-cultural competencies required to interact effectively with diverse populations, individuals, groups, and communities. This embodiment of attitude and practices that results in inclusive uh, behaviors, practices, programs, and policies. Communication is so crucial one as well, which involves the exchange of ideas, opinion, and information. Again, I'm going fast, but it's the self explanatory. And the last one is leadership. And when you say, and I think this is student level, I want to clarify that the leadership competencies is that yes, obviously you are not going to be a supervisor because you are currently a student, right? But again, leadership starts with oneself, how we manage ourselves, and that's the reason if you read the sub competencies under the leadership, you will see that it's it's how to ethically manage yourself as well. That's a part of the leadership. Okay, so keep that in mind when you go through these competencies, and be creative how you apply for them. So the crucial question is that why be aware of your own competencies, and why do we have this assignment, right? So, and this is why it is so important that accurate self-assessment is so important. Like for instance, I'll give you an example. And so this is, and I have served on quite a few admissions committee, job search committees, and so on. So based on my knowledge, what I can tell you is that sometimes it's a competitive world. But many times when you apply for a job and you don't get an interview, it's because either you haven't prepared your application that is tailored to that position, which will address that in the job application. But sometimes students don't apply to the strengths. And that's the reason why sometimes they don't get an interview, or they don't be successful. So because, and the reason why they do that, because that they sometimes what we do is that we live in so busy world. Sometimes we don't stop and think what we are doing. Sometimes we don't self-assess ourselves. An accurate self-assessment is so important. Knowledge of our own strength and areas of relative weakness, so that we can improve on. It's so important. And if you apply for your strengths, the chances of being successful are so high. And this one, when you identify areas of weakness, it's important that we work on those and improve on those. It also helps you identify where do you fit in the range of public health practitioners. And again, this is a so crucial fourth year course. I want you to Ask yourself that question, because I'm the public health program coordinator as well right now. And I think when I used to, like, before this COVID-19 pandemic, I think a lot of students used to stop by my office. And I think that's one common observation that I made, is that sometimes students don't know where they want to practice. The part of the reason I think is that's the case is because they haven't done the self-assessment very well or at all, or sometimes they don't know where they want to go because they haven't thought about what really makes what really they like to do, right? So it really helps. Like, once you know your strengths, once you know your potential weaknesses, it helps you identify a range of where do you fit in the range of public practice. It's so big field. You can do so many things. So to be once you analyze the competencies, it helps you, it guides you in certain way. It helps you identify the questions, where do I want to work? Again, that's the questions many students struggle with. So hopefully these competency assignments will help you with that. It directs ongoing professional development and lifelong learning. Key thing, no matter how many years of experience one may have, but there always be learning opportunities, even for myself as well. I always, like, every year, I make sure that I spend certain hours, certain days, certain time of a year in professional development. And that's the reason why we have this assignment that's built upon this as well, the lifelong learning. It's so important. You cannot, like, for instance, if you're practicing physician and you are, think about that a physician gives the treatment that is that the, he may have studied 20 years before when he was in medical school, and he never updates his knowledge. He or she, the physician, never updates knowledge and just continue to guide the treatment what the physician learned in the medical school, right? It's not appropriate. The same thing in public health. We are in a field that we practice in evidence-based public health. Evidence constantly change. When I say evidence constantly change, means that there are a lot of new research, there is a lot of new information that comes in, and we need to adapt to that. We need to be mindful of what is going on. And if we don't, I don't think we can be effective public health professional. So the competencies allows you to do that, right? For instance, if you know that this is not my competency, that you know that you need to work on that. So competencies, what are the benefits of having a core competency in public health practice? And are the potential disadvantages to having established core competencies? And if so, who are they? That's a question. I'll end the lecture with. I want you to self-reflect on those. I'll incorporate some benefits of having a core competencies in public health, or I'll create a moral discussion thread where you can brainstorm your ideas and pose a response to this question. Uh, okay. So with that, I finished today's lecture on core competencies, but now I want you to do is that I'll give you instructions on the core competencies, how you can complete the core competency assignments, uh, and how do you get started on that. So I'll share the screen again, and oops. Share screen. So this is what the template is. Core competency self-evaluation template. It's again, these core competencies, it's the same document that we developed by the Public Health Agency of Canada. So again, before you start filling out the template, this is your first assignment. You need to fill out this template, core competencies. Before you fill out, make sure you understand the criteria, evaluation descriptor. Make sure you go through them before you grade them. This is so crucial. Don't start your assignment before you you have read this carefully. For the first core competencies, like, so this is the public health science is the first core competencies. Description is listed here. 1.1, 1.2, these are the sub competencies within these competencies. So make sure you, first of all, make sure you know the core competence and the sub competencies well. Again, I'll include that link on the Moodle as a required reading. Make sure you know that, but it's also listed here as well. So what you will be doing for each competency and the sub-competencies is that you will assess your competencies. And again, this will be hard. I know that it will be hard sometimes, but it's so important. It's so important. Don't, and again, as a student, I think you may, and I've noticed that sometimes students underestimate their competencies or they overassess their competencies. Which you should practice is that try to truly assess where you are. Okay. Sometimes under assessment, it's not great. Like for instance, if you're in an interview and you are under assessing your competencies, it will not help you gain a job or position. And even if you get that position, it will not help you negotiate the salary that you deserve. So that's the disadvantage of underestimating your own competencies and overestimating competencies as well. That doesn't look good in the interviews for the positions as well, right? So it's so important that you crucially hit that strike the balance between the two and accurately assess your competencies. And again, no one knows yourself better than you. Okay, no one knows better than you. So, but then you will ask me the question, then how I'm going to grade this assignment? I'll tell you how can I grade your assignment. Uh, so first of all, you will rate your competencies in. You can use the different symbols that you want to use to fill this either check mark or whatever you want to use where you rate your each sub competencies. Then the second question is how important this is to your long-term career goals or plans. Because some competence sub competencies you may feel like it's not that important for where I want to be in future. That's absolutely okay. But if you don't end up saying that not important, not important, not important, all the competencies and sub competencies, then I think you're in the wrong field, right? So that's what it is. So first of all, I think you need to think about what your long-term career plan and goal is, and it is important to develop. And that the last question is yes or no. Is it important to develop or strengthen as these sub competencies as per your long-term career goals or plans? And then you answer the question yes or no. Okay. So and then once you rate those, below each competencies, you have the areas of demonstrated strength and areas of improvement potential plans. Here, again, the key part is provide specific examples. And again, here, potential action plan. When your action plan, and I'll tell you what the expectations are. How many examples do we need? And is there a magic number? No. Okay. Uh, what I want you to do is that, for instance, is if you have said competent or established competent or something, either of those two, you should reflect on what activities, what have you demonstrated in the past 4 years that provides you some evidence that you have incorporated or achieved that competency. And that's why I said you may have to go back to the courses that you completed, how many course objectives you have met, and so on. And again, it doesn't have to be the course, it could be a lifelong experience as well. And I'll talk about that in a while. But again, so you provide the competency specific examples in here. There are number of ways you can provide those specific examples in bullet points. Again, provide in bullet points. You can provide that in the bullet points by each sub competencies. That's great. You can compile them, all of them together. That's fine as well. Okay. So let's just say if it's a 1.1, you can say competency 1.1, and then you list the bullet point specific examples. The bullet points do not have to be more than 2 or 3 sentences long, right? But again, to the point, concise, clear, specific examples, right? Not a generic example, but specific example where you demonstrated those sub competencies is so important. And then you also have areas of growth and improvement or potential action and with potential action plan. So like, for instance, if you say 1 point, just an example, 1.5, you are beginning competence or not yet competent. And even if you're competent and you want to go to establish competence, and if you think that's important for you to develop in the long-term career plan, that's a yes as well, then we have to improve, right? We have to build. And even though I think sometimes it doesn't have to be, it could be self-established competence, but you still, there is a growth. There is always going to be the growth of improvement. So provide some details, like if you are particularly for the lower end of the spectrum here, provide what's your plan moving forward. The more detailed the plan is, the more specific the plan is, more likely you are going to follow up with action. So include some timeline. When do you anticipate doing that? That's so crucial. If you have a remaining course that you are planning to take in the summer, if you're going on a practicum, you include that in this year, this semester. This is what I would be doing. This is the training I would be doing. That this is the volunteer work I'm expecting doing the summer, and so on. But potential plan again in bullet points, no more than like bullet points specific one or, and when I say bullet points, sometimes students misunderstand that bullet points means you cannot provide details in the bullet points. No, bullet points means you give concise, clear, and informative sentences there. Okay, so bullet points means very clear, concise, and informative. So make sure you do that. Areas of growth and improvement. So that's what you'll be doing. So that's, and again, it doesn't have to be the activities. Again, it could be for you can provide these examples where you have demonstrated these competencies or gained those competencies. Could be any courses or any activities in the program, any extracurricular activities. If you're working at something, you could include those examples as well. Uh, it could be your personal examples too. For instance, is communication. You can demonstrate uh, how, if you are working in, let's just say, communication, yeah, diversity and inclusion is, if you're already working in a job, let's just say if you're working even as a cashier, if you're a customer care representative or something, communication is the key, right? You can demonstrate those with specific examples there. Okay, so I hope this helps. So you can use any personal, professional, uh, curricular, extracurricular, any examples. But again, make sure those examples demonstrate that you have learned or gained those competencies, right? So that's a whole assignment for each competencies and sub competencies. You rate yourself and then you provide comments in either of those boxes. So that's a whole assignment. And once you, and this is once you click on this is where the core competencies document is in there.